Okay, so guys, just by way of introduction, so my name is Michael Greenfield and I'm the CEO of PrimeSource, and our objective is to interview operators and vendors and bring all the education together because we believe in the concept of together we are experts. It takes the vendors, the operators, the service providers to all work together in unison to give our ideas and our concepts in order to grow in our industry. And our industry of healthcare and senior care is evolving literally every single day. Regulations, compliance, survey challenges. It's something that we face on a daily matter. And we're joined today by Christine Jones with HD Supply. Christine, why don't you give us a quick introduction to who you are?
Okay, hi. My name's Christine Jones. I'm a strategic account executive with HD Supply. I've been with the company about 15 years now. Worked my way up. I was a rep out in the field, and then I was a sales manager over the West Coast, and then I went into national accounts, and now I only manage GPOs like PrimeSource.
Fantastic. Love that background of you working your way up. That's beautiful. And so we're joined by Herschel Friedman, who's the Chief Operating Officer of a group of nursing homes in the New York area called Medco Enterprises. And Herschel, why don't you tell us a little about yourself for 2 seconds?
Good afternoon, and thank you for having me, inviting me on this program. I've been in this business for almost 30 years. I'm with Medco as a DOO for the last 25 years. And basically, I oversee and look for new ways to improve the safety of the facility, the residents, the families, the employees. That's the basic gist of the job.
Amazing.
But right now, safety, disaster preparedness is the focus at this moment.
Okay, excellent. So, I mean, hopefully nothing comes, and we have to be as prepared as we can. HD Supply is a huge company, and I know there's, had been so many mergers and acquisitions, and Home Depot, and what is HD? Does it stand for Home Depot? Who owned Home Depot? Can you just give us a little bit of background of what is HD Supply? What kind of mergers or acquisitions have you had? What kind of coverage do you have as a company?
Wow. Well, if you want me to go back a little ways, Home Depot originally bought a company called Maintenance Warehouse. And when they did, they changed the name to HD Supply, Home Depot Supply. So it was a business-to-business distributor arm of Home Depot at the time. They sold us off a few years later. And so we were actually competing against Home Depot, HD Supply was. When Home Depot saw how well HD Supply was doing, they developed a division called HD Pro to compete against HD Supply. And in the process, they purchased companies like Interline, Supply Works to compete against HD Supply. So for a while there, we were competing against each other. Now Home Depot has bought HD Supply back. So our competitor, and we're now under the same umbrella, HD Pro and HD Supply. The merger is not complete yet. So essentially the two companies still operate separately, yet HD Pro is now called HD Supply to make things.
Is this a good thing for the clients?
Oh yes, it's a great thing. So if people have worked with HD Pro, you understand that they're the old Supply Works, and Supply Works was the king of the janitorial industry. And so they have really good products and pricing on HD Pro. So yes, it's a good thing that now HD Supply is going to get access to that janitorial, just not happening yet. So my recommendation in the meantime is you kind of have to keep them separate, but if you want to purchase EVS or janitorial supplies, use your HD Pro account. And if you want to purchase MRO, which is maintenance, repair, and operations, use your HD Supply account. But
good, and we're going to focus And we're going to focus on MRO for today. Maintenance, repairs, and operations is exactly what we want to talk about because at PrimeSource, we're trying to talk about things that are relevant. And right now, being that we're, getting into spring, preparing for the summer, it's on everybody's mind. And I want to talk about that. Before we do, what kind of products and services does HC Supply offer in general?
In general, it's maintenance, repair, and operation. So if you think of a facility, it's everything to keep the facility running, from the lighting and electrical and plumbing to the HVAC. And then we even get into the tools, the hardware, and we even work with Drive Medical so we can provide the beds and the wheelchairs, privacy curtains, and that side of things.
Do you have an exclusive with Drive Medical?
Not an exclusive, but we are a primary distributor for them.
Oh, okay, great. That's great to know. So that takes me into my next question, which is how you guys are specifically focusing on the senior care space. You guys are such a large outfit that there's so many different variable categories of service that you can provide for. How do you particularly focus on the senior care space?
Yes. So we have different divisions within our company, like multifamily, hospitality. We call it healthcare. It's essentially senior living. But we have merchants who work very hard in the background, looking for products that are specific to senior living facilities, like ADA hardware, nurse call beds, wheelchairs, that sort of thing, but also like understanding lighting and how it affects seniors. It has to be not so bright, but more of a comfortable feeling in the facility because this is where they live, right? This is their home. So the goal is to make the facility as home-like as possible. So our merchants go out of their way to try and continually look for products like that will service the entire facility. So anything that could keep the facility running smoothly, we probably can source it, including the furnishings like in the common areas or the dining rooms, that sort of thing.
Okay, fantastic. So the next part of the questions directly affect the facility itself. I'm so excited that Herschel's here simply because his background of what he was referring to in terms of safety is not just about that. I know Herschel for a long time, and I could tell you in visiting his buildings, he doesn't just take safety as his number one concern. He makes it his life mission. I don't want to embarrass him, but I'm going to ask him to tell us the story about the time that he tested the call bell system.
I have better stories than that.
Let's start with the call bell system. How do you test the call bell system, Herschel? Please tell us.
The way Herschel Friedman tests the call bell system is I sneak into the building in the middle of the night. The security guards, receptionists, nobody knows that I'm there. I take the back staircase up to one of the units, sneak into a room, gently knock on the door and announce myself, of course. I let the resident know what I'm doing, that I'm checking their call bells. I press the call bell button, listen for the call bell sound, and the light over the door to flash. And then I hide in the room. And document all this. I time, document it, and wait. If there is no response, if it's between 12 and 4 in the morning and I don't get a response, I quietly tiptoe through the hallways looking to see where the staff is. If I don't see them in the hallway, I check every single room. If I find anybody sleeping, with the company I'm with now, that doesn't happen, but there are other nursing homes that hire me to do these kind of things. But the company I work for, Medco, we don't have this problem. Anybody sleeping, I photograph.
This call is more fun than I expected.
Then I send the photo to the operator, owner of the nursing home, and then they deal with it. When any staff member that responds within 2 minutes, they get $10. Mm-hmm. That's how I do the call bell checks.
You know, Herschel is not only the director of operations, people seek him to bring on his expertise and consult for facilities that are having safety issues. And would love for you to share another story, Herschel. I know that you have a lot. There's fire safety issues. I know that there's fire blanket challenges that facilities have. Why don't you teach us and tell us what are the things that we need to look out for in terms of things that we may not even know can come and haunt you one day? Because if you think you're following regulations and you're doing well, it's not just about following regulations, it's about preparing for the worst. So I know you have some stories in your arsenal about that.
Okay, a nightmare story is in regards to elopement. For those that don't know what elopement is, it's when a resident leaves the facility unnoticed and now is in harm's way because they could get hit by a car, they need their meds, it could be in the middle of the winter, summer. And it's not uncommon to have residents that actually get into accidents and actually die from elopement. The story about elopement is if someone gets out and we don't realize it for several hours, the issue will be the kind of documentation the nursing department, dietary department, rehab department, what are they documenting regarding this resident and the hours that the resident's missing and they don't know that they're missing? The issue is if when we do find out that a patient's missing and it's reported to the Department of Health, during those hours that he was missing, did dietary document that food was delivered? Did CNA document that the resident ate 80% of their food? Nursing gave out the medications. CNA showered the resident, but meanwhile, they weren't even in the building. This has happened. And obviously, falsifying documentation is illegal. And people have served time for this. What's my point?
It's ways to prevent these things from happening.
Okay, ways to prevent it is like this. If I'm a nurse giving out medication and I come to the room and the resident's not there, I don't have to worry that moment that the resident climbed out the window. But I do need to know where the resident is. Or when the tray is picked up after lunch and the food wasn't touched, we need to find out why. Maybe the resident's out on pass, doctor's appointment, but maybe not. Maybe the resident's lying in a staircase somewhere, on the roof, or gone, left the building. So we can't ignore these little signs.
That's amazing.
It's everyone's responsibility when it comes to safety.
I appreciate that, and I wish we can hold a sign up and actually say this. It's everyone's responsibility in the building when it comes to safety. Whether you're cleaning the closet, whether you're the security behind the desk, whether you're a CNA or an LPN or an RN or a FSD, everyone in the building is responsible for the safety. I love that message, Herschel, and we're going to use that. And we're going to go right into the idea of compliance and codes and surveys. Christine, I have a question for you. What is HD Supply doing in the senior care space to help facilities stay compliant, prepare for any violations, prepare for survey readiness? What is it that HD Supply can offer to facilities that helps them in this challenge?
Well, we can help with like F tags and K tags, Herschel, right? You know what those are. So the K tags fall more into the safety that Herschel was talking about. So it's things like emergency egress, making sure there's proper lighting in case the electricity goes out, making sure the door handles are levers that are ADA compliant so residents can get out, making sure they don't that they remain unlocked and so they can get out quickly. Fire detection, of course, with smoke alarms, carbon monoxide alarms, fire extinguishers readily available. And then, of course, like combustible handling. So we have like storage lockers and containers, even fire prevention trash cans. So in case like something gets put in a trash can, it won't start a fire in the building, that sort of thing. Now, when it comes to F tags, those are more Where K tags are more about the facility, F tags are more about the resident. So resident comfort is something they look for. Is the temperature cool enough or warm enough, depending on the season? Do they have everything they need to make their life comfortable? So whether it's a correct toilet seat, or if there's a fall pad next to the bed, those sort of things. They just want to make sure the residents are safe and comfortable. Also things like cleaning supplies. We need to make sure the facility is clean and is being cleaned properly. We have
now at HD Supply. Do you have training for the employees that understand the difference between you're effed with an F tag and you're okay with a K tag? Like, is that something that you guys discuss internally and the reps know how to handle or talk to the facilities in their language? Herschel, any questions about compliance stuff, code, survey readiness, a product perhaps that HD Supply has through their manufacturers that would help in terms of running your building safely?
It's very interesting that you bring this up, because we were using a product for our facilities that's a very well-known product, a disinfectant that everyone uses, everyone has in their house. And during state survey, during COVID, the height of COVID, the state wouldn't even walk into our building, but they would want to see, we'd walk around with our phones. They wanted to see what the porta closet looked like. They wanted to see the chemicals we were using. And they said, read us the content label. Read us about the kill time. Is it EPA registered? Anything that's not EPA registered, we can't even keep in the building. We'll get tagged for that. So we were using a product to mop the floor, for example, and it would disinfect, it would kill COVID. But the COVID kill time to disinfect was 5 minutes. Then we found the product 2 minutes. Kill time, by the way, what that means is if I spray a chemical on this desk and it says 2-minute kill time, it means the desk has to stay wet for 2 minutes to disinfect. If it dries up before the 2 minutes, it means it's not disinfected. So when it came to COVID, we were using a very popular chemical, and it was a 5-minute kill time, and the state said that's too long because it's a safety issue. The floor has to be so wet for 5 minutes that it's a fall risk for staff and the residents. So we went to a website, a state website, a federal website. We found a list of different chemicals, and we found that one that disinfects COVID within 30 seconds.
Wow.
And it's a little bit more expensive, but it's the only thing we'd use. It's safer, kills faster, and it's EPA registered.
It's something that I learned about you guys, Herschel, as a client, as a senior care facility, is that you'll spend more money in order to save in the long run. And that's something that's a motto that I think that more operators need to be more in tune with. It's sometimes worth spending more money for a better quality product so that the outcome is better, so that the labor is less, right? Can you give us, Herschel, another example of where that would be like in your building in terms of where I'm spending more, but I'm getting so much more out of it?
Well, put it this way. The fact that I don't have to make the floor so wet, it's also an insurance system. For the safety of the staff, slip and fall.
Workman's comp.
Workman's comp. It's a big, we've had less falls actually.
Wow.
Less slip and falls.
That's smart.
So drying the floor quicker.
We're not making the floor as wet. We don't need to.
That's great. And that brings me into my next topic, which is best practice. So we'll move over to Christine for a second. Are there any best practice tips or methods from you as an organization that you guys think of and saying, hey, you know what, we want to implement this into a facility. We want to teach the facility about a product or a service?
There's so many. We do have what we call a green team.
We'll do this again next week.
That's okay, yeah. We do have a green team, and what the green team will do first off is we'll tell them the property location. They'll find out who the local utility company is and check and see if there's any rebates going on. Once we find that, then we can see if any of those rebates are applicable to our products and the facility, of course, and ways that we can save electricity or we can save water, for example. So some examples of times I've used them is like for an LED upgrade. They ran an ROI for us to show the savings it would be to upgrade one bulb to an LED bulb. Of course, the cost up front is a little more than a regular bulb, but you don't have to change an LED bulb for 7 to 10 years, sometimes more now. And so the cost savings is very significant. It more than pays for itself in the long run.
That's amazing. So we're talking about best practice, and you're shooting at me right away, LED, and that is a great answer. LED is an answer from probably already over a decade ago when it started in terms of the conversions and the rebates and the expense versus the reward. And that's a great example. I absolutely love that. Herschel, can you give us an example of a best practice method that you did similar to what you did with your floors or drying the floors? Something within the building that has to do with safety or a process of using a product.
Well, we're actually switching over to LED right now. About building it.
Yeah,
Fantastic.
That's awesome.
Yeah. It's called systems. You have a system for everything. Special scheduling, when to do what, whether it's floor stripping, whether it's checking all the electrical equipment. That's what it is. It's just systems and scheduling.
You know, I like that. Let's talk about the floor stripping, Herschel. In your experience, what I mean by best practice is how often do you actually have to strip and wax, and how often do you have to shine? And you know, these are questions that people ask all the time because they just rely on the personnel and that think they know what they're doing from where they came from. But you know that old story about doing things over and over again.
Okay, so for our buildings, every building is different. Depends how much traffic you have. Depends on which floor. But in our building, we strip and wax the hallways every quarter. The rooms get done every 6 months, and it works. And we use the better products.
Right. So using higher quality products in order to get better results.
Correct.
Yeah, I have a question for you, Herschel. You know, we talk about the motto. You know, the team motto. You know, we said earlier, safety first. You know, everyone is responsible for safety. Is that a good motto that you think that would resonate with your organization as a whole?
Yes.
So, and that's perfect. And we're going to use that motto when talking about your organization. At HD, Christine, what's your motto?
Our motto is we're on it. So there's so many things that come up in the day-to-day running of a facility, especially with senior care. So I never want to say that's not my job and I don't know the answer. I will find the answer for you. And that's a motto that runs across my team and runs across my sales force. So they're very resourceful, and they don't take no for an answer. Like if they can't find an answer, they'll keep asking and trying to find the right people to get the answer.
Fantastic. I have a final question, and then we're gonna close off with any questions or Q&A or any other thoughts that we want to talk about. But my prepared final question is, what is, Christine, your tip for summer prep? What would you say is a necessity that summer's coming, you have to do A, B, C, and D? And Herschel, yes. We're going to end with you answering that question as well.
Okay, well, obviously summer gets warm, it gets hot, so we need to have the maintenance staff kind of run through and check all the units. So if there's PTAC units in place, we need to have those inspected. If it's central air, we need to have the condensers inspected, the air filters changed, that sort of thing. And we do provide preventative maintenance service if that's a need. So that's where I would start. You know, I know right now there are staff shortages, so it does make it hard for some facilities. So again, we can provide that service if that's needed.
And that's a great tip. Summer's coming, HVAC system maintenance. You know, I actually pay for a warranty program, and I can't tell you how many times they text me and email me, summer's coming, check your HVAC. So that's a great tip. Thank you for that. Herschel.
Everything Christine is saying, I'm actually documenting.
Well, can I add to the PTACs? If there is storage room in a facility, and I know some facilities it's very limited, but if it's possible to order 1 to 2 extra PTAC units to keep on site. So when it's Friday night, you know, 8 o'clock and the unit goes down, you can't have Mrs. Jones without AC, right? I mean, in some situations, it affects their health, so they have to have it. So my recommendation is, if it's possible, to have an extra unit on site.
I like that. I like that point. Thank you for that. Herschel, what would be your summer prep ideas?
Okay, summer prep idea number one, as Christine said, ACs, air conditioning. So we have a maintenance team. I have two HVAC people on staff in our buildings. They're doing filter cleaning now, making sure they're working, inspecting them, putting the inspection tag on it, and documenting. A big one for the nursing home is window functionality. You know, a window cannot open more than 4¼ inches to follow the code, because you have to prevent anybody from going through a window. So what we do is we check each window, make sure there's a top screw and a bottom screw, that the window can't be lifted and pulled out or slide open, because that's a big one. Summertime, as the weather gets better, people want to go outside. So the window functionality, elopement prevention, nice weather, people want to leave. So
that's great. No, that's great. That's
temperature is inspected, make sure it's not rusted, make sure the joints are strong to prevent.
Can I add one more, Michael?
Please.
So summertime is when the kids are out of school, right? So there are a lot more families going to be visiting their, relatives. And so one tip I would say is look at your signage in your facility. So when a guest enters the front door, yes, they have to check in, but is it easy for them to find grandma's unit? Is the signage clear enough where they know how to get to that unit? Otherwise, you'll have families wandering the halls, maybe stumbling into situations that they really shouldn't be. So I would recommend making sure the signage, even like take yourself, walk into a facility and just see, is that clear for me to understand so that families can understand.
Excellent.
Mm-hmm.
Let me take some more notes here.
Call me.
Herschel, I know that if I asked you to tell me stories that were interesting and unique in your background of doing work, you keep me on the phone forever. But I want you to dig deep into your brain and tell me one other story that I can utilize to teach people the importance of safety, or something that could be prevented. And I know you've told me in the past so many, and if you can't think of any, I'll jog your memory.
Westchester County, 1989. It was January. During state survey, a surveyor walked into a resident room. There was a no smoke posted outside the room. The housekeeping porter was leaning against the wall by the bed where the resident was lying down, with a mop stick in their hand, smoking a cigarette in the other hand. During state survey. You tell me why this gentleman, this housekeeping porter, did not lose his job. In fact, he did not lose one day of work over this.
Wow, that's a great question.
The answer, we pull the file. His training, in-services, meetings, policy and procedures. Upon hire, everyone has to be trained. He was never trained, at least documented, that it's a non-smoking building. He was never trained that you cannot have a fire by an oxygen tank or a compressor. And therefore, it was not his fault. It was his supervisor / administrator for not making sure this person was trained properly. Training is a big one. Proper training. And didn't lose 1 hour of work.
Wow. You probably can't say the same about the administrator, but that's a whole other story, I guess. I want to thank you both for joining us so much. I look forward to many more interviews together where we can learn from each other about best practice, and we can feed off each other's energy and really just go back to the originating motto that Herschel had, which I love it, which is we are all responsible for each other's safety. Thank you very much, guys. Have a great rest of your season. Take care, everybody.